I'm Dr. Sri. I'm a primary care sports medicine doctor practicing in the United States. So there are a lot of options out there for treating knee osteoarthritis. But which one is right for you and your hard-earned cash? So in this video, I'm going to compare three popular options, which is platelet-rich plasma therapy, hyaluronic acid injection, and finally physical therapy, and eventually help you make a decision. So when a patient has pain secondary to knee osteoarthritis, the pain is coming due to inflammation and also the exposed bone without articular cartilage coverage. So the patients start developing muscle stiffness and pain, which can eventually make it difficult to engage the muscles properly, which can then put unnecessary stress on the arthritic knee and thereby worsen pain. So what happens when you go to physical therapy? So physical therapists can help relieve pain in the knees by stretching the knee joint capsule and the muscles. They may also do some mild distractions of the joint itself to help reduce pressure between the joints. Eventually, they will focus on strengthening the muscles so that they can take the stress off the knees. So in my clinical experience, patients usually tell me it takes around 12 sessions of therapy to start noticing a significant difference in their pain. So now the biggest question is that, does physical therapy really work? And the answer is yes. A recent New England Journal of Medicine study compared physical therapy and cortisone injection and found that at 1 year mark, people in the physical therapy did far more better in terms of pain improvement compared to cortisone injection. So one thing you have to understand about this study is that, so they looked at 1 year mark. So they're basically looking at the finish line. But let us say if they looked at a 3-month mark, based on my clinical experience, I suspect that cortisone injection could have provided far more benefit than physical therapy. Because the answer is that physical therapy usually takes a little bit time compared to cortisone injection, which can give a quick short-term improvement. But at 1 year mark, they found a 70-point improvement in a scale that actually looks at knee pain, disability, knee function, and so forth. So based on my guess, the cost is probably going to be around $600 to $1,200 if you're going to pay by cash for 12 sessions. In India, I'm assuming that it's going to be around 7,000 rupees for 12 sessions. So what about hyaluronic acid gel injection and another expensive therapy if you don't have insurance? So the lubricating gel injection for knee arthritis works by reducing friction and inflammation. Although the mechanism of action is complex, this is a general overview of how the injection works. So I made an entire video on this topic and I've attached a link in the description box below if you want to know more. So let us say you don't have insurance. Each injection might cost anywhere between $400 to $1,000 or more, depending on what injection you choose. So there exists some controversy about the effectiveness of this injection, but most of these studies actually do show that this injection works. So there's no systemic side effects from this injection. There might be procedural risks such as bleeding or chance of introducing infection, but other than that, this is actually a really safe intervention for knee osteoarthritis. Hi guys, is this video helping you? If the answer is yes, this video is likely to help more people. In order for the video to reach more people, I would request you to hit the like button and please post some appreciation in the comment box below. If you really want to keep in touch with me and if you like this type of content, please make sure that you hit the subscribe button and the notification button. Thank you. So what about platelet-rich plasma, also called as the PRP treatment for knee osteoarthritis? So platelet-rich plasma therapy, which involves drawing your own blood and centrifuging it to get a plasma rich in platelets and growth factors, is becoming a popular treatment for knee osteoarthritis. So the biggest drawback of this PRP injection is that we still don't have a standardized PRP preparation, and therefore the effectiveness of this intervention is still being questioned. I've covered 2 videos on this topic and I've attached the link in the description box below. So there is evidence to suggest that PRP injections may be more effective than hyaluronic acid injections for treating knee osteoarthritis. However, it is important to note that not all studies have observed this. Additionally, PRP injections are usually not covered by insurance and they can cost anywhere between $500 to $2,000 per injection. So this is not a textbook answer, but let us say if a patient comes and asks me, right? The doctor can provide either PRP or hyaluronic acid injection and the patient does not mind about spending some extra dollars, then I would recommend PRP over hyaluronic acid injection, provided that the physician has a good experience and knowledge about PRP injections. So now let's go back to the first question. Which one should you choose, physical therapy or the injections? I would suggest choosing physical therapy first. The physical therapy can help you strengthen your muscles and joints and is devoid of any side effects. This video was helpful. If you have any questions or comments, please post in the comment box below, and I'll see you in my next video. Until then, goodbye.